Hey, this is John Hans with the LBL Group. Thanks for joining me. Today we're going to talk about HSAs, or health savings accounts, why they're important, what you need to know about them at open enrollment, and how to make the most use out of them throughout the year. So to start with, an HSA or a health savings account, in short, is just a tax qualified account that you can use to pay for general medical expenses throughout the year. So in terms of how you get one, an HSA account is only available to you if you have a high deductible health plan, an HDHP. So when you're at open enrollment, it's important to understand and ask, hey, is one of our plans a high deductible health plan? If you do have access to one, enrolling in that plan makes you eligible for an HSA account. Now, HSAs aren't for everyone. They definitely require someone to be a little bit more of a consumer, and that's the intention for them. Now, there are certain drawbacks to having an HSA. One of those is obviously you have a higher deductible. So in a typical plan that you may have a deductible of 500 or 1,000 or $2,000. But employees enrolled in a high deductible plan may have a higher one. It could be 1,500, 3,000, 5,000 or more. Your HSA account basically helps you fund that deductible with tax qualified monies. So you're taking money out of your paycheck on a pre-tax basis. You're putting money into this account, and when you pay for medical expenses using that, and it could be co-pays, it could be prescription co-pays, it could be medical expenses if going to the hospital. It can also be over-the-counter medications, things you just buy from CVS or Walgreens. There's a whole number of items that you can use or that you can buy with your HSA account, what is known as HSA qualified medical expenses. Now, when you use those accounts, it's important to remember that the money's coming out of the account tax-free. So it's a really neat little tax benefit that you get where you are deducting money out of your paycheck on a pre-tax basis. And then if you're paying for medical expenses that are qualified, the money comes out tax-free. So it's this really unique tax qualification that we don't see in a lot of other financial products. Now, the key thing to keep in mind, though, is that with that higher deductible, you need to be thinking about when medical expenses are coming up for you throughout the year and how you're paying for them. So one issue that we run into with HSAs is people, are not making contributions to the plan, but they're in that high deductible plan. So they're paying slightly lower premiums for the higher deductible, but they're not funding their HSA. So when they do have medical expenses, they suddenly need to meet this higher deductible that they weren't really ready for. So you need to be a little bit more thoughtful about how you're putting money away. But they can be really good vehicles for people who are conscious savers because at some point we're going to have medical expenses. You may be young and healthy and not see the doctor too much just now, but at some point you're going to be seeing a doctor and you're going to be incurring medical expenses. The HSA account can be a really good way for you to put money aside, planning for that eventual spend. And the reason that it's really effective is a really simple example. Think about having a baby in this country, right? So that could be anywhere from $5,000 to $10,000. If you are in a tax bracket that means you're paying a little bit higher taxes than the average person, you may need to earn $15,000 or nearly $20,000 to be able to pay for $10,000 for that pregnancy, right? So you can start to see where there's this value of it because if you're just paying with a debit card or your credit card, you're going to have to earn that much more money to pay for these medical expenses than if you were to use your HSA qualified account. So an important thing with HSAs though, and the reason that they've fallen down a little bit in certain terms, is that we need to have access to great information. Because if you don't know how much something is going to cost, you can't be a smart consumer of healthcare. That's something that HSAs have really tried to push for, but there's not as many great information tools as I think we anticipated when HSAs came out. So in short, HSAs can be a really good plan for you if you understand how they work and you're going to take full advantage of them. They have contribution limits just like your IRA or your 401k do. This year, moving forward into 2021, that's $3,600 for an individual and $7,200 for a family. So if you think about it, you can put aside up to $3,600 as an individual, and if that doesn't get spent in this year, you get to roll it over into next year. That's a really cool value for people because over time, you can actually start to invest your HSA money. So HSAs can be a really strong component of your overall financial picture. You need to have a high deductible health plan in order to have one. And if you do have one, there's probably more expenses that you have that you're paying for right now just with your debit card or your credit card that you could be paying with your HSA account. So if you have questions about how your HSA works, ways that you can use it to pay for medical expenses, and what to know about your plan moving forward, please let me know. I'm here to be a resource. Thank you and have a nice day.